Hi guys, this is my first video lecture and I hope you like most. So here we talk about today about the abdominal aorta, right? So talking about the abdominal aorta, it is the continuation of thoracic aorta, right? So after level T12, the thoracic uh, aorta converted into the abdominal aorta and it extend up to level L4. It means up to here. In this picture we see up to here. Okay, after that this is converted into common iliac artery, right and left common iliac artery. It's bifurcate into right and left common iliac artery, right? So here we came to know about the abdominal aorta, that uh, it is a continuation of thoracic aorta between the level T12 to level L4, that is the lumbar vertebra L4. Now we talk about the branches of abdominal aorta. Here we have branches of abdominal aorta, and we came to know that there are the three branches. Okay, uh, there are the three branches anteriorly. Here we see 1, 2, and then 3. This is known as anterior visceral branch, right? Anterior visceral branch. Uh, visceral means related to organs, right? Organs, that is the spleen, liver, uh, kidneys, such things. Okay, so here we came to know that there are the three visceral branches, anterior visceral branches, right? And the very first one is a celiac trunk, okay, that lies at level T12. Here we have celiac trunk. This is what anterior visceral branch. And how many we have anterior visceral branch? Three. So anterior visceral branch, the very first one is the celiac trunk that lies at T12 level. Okay, the second one is superior mesenteric artery. It lies at L1. Similarly, inferior mesenteric artery, and that lies at level L3. So let us revise. We came to know about abdominal aorta, that it lies between T12 to L3, L4, not L3, L4. Okay. Similarly, we came to know about anterior visceral branch of abdominal aorta, and that is celiac trunk, superior mesenteric artery, inferior mesenteric artery. Right? Now, now in this picture also we can see easily that this is the celiac trunk, anterior visceral branch of abdominal aorta, superior mesenteric artery, inferior mesenteric artery, right? Now when we talk about lateral visceral branches, okay, lateral visceral branches, then we see then this is the first one, then two, and then three. Okay, it means the visceral lateral visceral branches are three. These are in pairs. Okay, these are in pairs. It means here we have seen that these are one in number. Okay, each are one in number. But when we talk about the lateral visceral branches, it consists of the two branches, okay, for each. Okay, it means they are in pair. Okay, so there are also three branches of, okay, but they are in pair. Here we see the very first branch of uh, lateral visceral branch. The very beginning we have learned about the anterior and then visceral branch. Anterior visceral branch means anterior, and that supplies the organs. Okay, anterior branch that supply the organs, that are the anterior visceral branch. Lateral, okay, that supplies the organs are three in number, and that are the middle suprarenal artery. Okay, middle suprarenal artery. Here we have middle suprarenal artery. The very first one is means 1 and 2. These are impaired. Okay. Similarly, the second one is the renal artery. Here the name itself so that it supplies to the visceral organs. Okay, visceral organs. Okay, so it is known as what? Lateral visceral branch. Middle suprarenal, renal which means kidney, it is supplying to the upper parts of the kidney. So middle suprarenal, the very first one is. Second one is the renal artery. Okay, it of course it supplies to the kidney. Okay, then we have gonadal artery. Okay, so we came to know about the three. These are the three arteries that are lateral visceral branch of the abdominal aorta. So we let us revise at first. Okay, we have learned about the abdominal aorta that is lies between T12 to L4. Then we came to know about the anterior visceral branch, and that is celiac trunk, then superior mesenteric artery, and then inferior mesenteric artery. Similarly, we came to know about lateral visceral branch of abdominal aorta, and these are three in number and each are in pair. Okay, it means the very first one is middle suprarenal artery. Okay, middle suprarenal artery, then renal artery, and then gonadal artery. Okay, important things to remember about the gonadal artery is in male gonadal artery is known as uh, testicular artery. Okay, similarly in female it is known as ovarian artery. Okay, gonads, it is related with gonads. Okay, so now we came to know the third things we the fourth thing. Okay, we have to know the very first one is the abdominal aorta. What is abdominal aorta? The second is anterior visceral branch of uh, abdominal aorta. The third one is um, lateral visceral branch of abdominal aorta, and the fourth thing we have to remember that lateral abdominal branches. Okay, these are not related to visceral. Okay, but are lateral abdominal branches only, but not related to visceral part, visceral organs. Okay, so these are five in numbers. Okay, the very first one is inferior phrenic artery. Inferior phrenic artery. Inferior phrenic artery is the, here we see at the very as the abdominal aorta start, the first we found that is the inferior phrenic artery. So if a question arises that which one is the in MCQ type question, which one is the first branch of the abdominal aorta, and the option are given, so we have to take that inferior phrenic artery, and it is, we should remember that it is a lateral abdominal branch. Okay, so this one is one, and the four is lumbar arteries. One is the lumbar arteries. Okay, here we have third lumbar artery, fourth lumbar artery, second lumbar artery, and the first lumbar artery. Okay, and these all are in pair also, and these all are paired. Okay, and these all are lateral. These all are lateral branch of abdominal aorta, but these are not the visceral branches. Okay, the visceral branch of lateral abdomen are of three, and these are of pair. We have already learned about this was middle suprarenal artery, renal artery, and gonadal artery. Okay, here we have inferior phrenic artery and four lumbar artery. Now when we talk about we have the thing fifth thing we are going to learn, that is the posterior branch. Okay, before that we again revise that the very first thing we have learned that what is abdominal aorta, that it is the continuation of thoracic aorta, lies between T12 to L4. The second thing we have learned about anterior visceral branch of abdominal aorta, which consists three branches: celiac trunk, superior mesenteric artery, inferior mesenteric artery. Okay. Similarly, we have learned about lateral visceral branch of abdominal aorta, and we came to know that these are middle suprarenal artery, and then renal artery, and then gonadal artery, and these are in pair. Similarly, we came to know about lateral branches of abdominal aorta, and there are five in number. The very first one is inferior phrenic artery, and the four are lumbar artery. Okay, lumbar artery. Okay, and now the fifth thing we are going to study, that is the posterior branch of abdominal aorta, and that is median sacral artery. Median sacral artery, and it lies here. We see from the posterior side. Okay, it down as median sacral artery. Okay, it is a posterior branch. Okay, now the sixth thing we came to know that terminal branches is there. As it reaches, abdominal aorta reaches level L4, then it bifurcates into two parts as right and left common iliac artery, which further divides into internal iliac artery and external iliac artery, right? Internal and external iliac artery. Okay, and the external iliac artery further divide means continue as femoral artery. Okay, so in this part we have to just learn abdominal parts, okay, of to L4, okay, between T12 to L4, and these other we will go in next video, details in next video. uh, so see you again. Don't forget to like and subscribe my channel, and hope for your best comment. Thank you.